This slide is showing the lateral view of the vertebral anatomy. And I want you to notice that we are looking at specifically the lumbar vertebrae. This, as you can see, is L1, L2, and L3, specifically the bodies. And the bodies are the thickest that we find in specifically the lumbar region. And that's because they're going to be supporting the large majority of the weight. So other important regions of this diagram you should be able to identify would be that fibrocartilage intervertebral disc, the superior articular process of L1 in this case, the pedicle, which remember is between the body, and where the spinous process would be, the intervertebral foramen, which is going to be where the spinal nerves come out of the spinal cord, the thoracic process, which sticks out laterally, the spinous process, as well as the inferior articular process, and on top of that would be the inferior articular facet. And in this case, the inferior articular facet is going to articulate with the next vertebrae down, which would be L4. These are characteristic features of cervical vertebrae, and in particular, cervical vertebrae have transverse foramen that are present in the transverse process. This is only in the cervical vertebrae because there are actually blood vessels which run parallel to the cervical region of the vertebral column. There's also a bifid spinous process only in this region. The spinous process is not going to be as defined as in other regions of the vertebral column. The superior articular facet, remember, is a flattened structure that articulates with, in this case, the vertebra that is superior to it. When we look at a lateral view of a vertebra, we can see the superior articular facet, which you just saw, the spinous process, which is going to be pointing posterior, the inferior articular facet, the transverse foramen, as well as the body. This is showing a thoracic vertebra. So in the previous slide, we saw a cervical vertebra, which would only have the transverse foramen in the transverse process. This has a body as well, but it's not going to be nearly as thick as in the lumbar vertebrae. There's a transverse process, but notice there's no transverse foramen in the transverse process. The spinous process is what points in a posterior direction. Again, when you palpate the back of your spine, that's what you're going to feel. Then there is a superior articular facet. That's the flat portion that's going to articulate with the vertebra superior to it. This is also showing thoracic vertebrae. We can see the spinous process. What's interesting about the thoracic spinous process is they look almost like the nose of a giraffe. They are downward in shape. There's a superior articular facet, again, that we see on all the vertebrae to articulate with the vertebra superior to it. The body, which is not as thick. And then in this view, I want you to notice that it's actually showing, it's highlighting the pedicle region. So the pedicle is what is highlighted in green on this slide. This slide is showing us another characteristic vertebrae, but now we're moving inferior. So this is a lumbar vertebrae. We still have the transverse process, a superior articular facet, and a spinous process, but it's not going to slope downward like those in the thoracic vertebrae. So it's the lumbar. It's a lumbar vertebra. We can see a lateral view of a lumbar vertebra. This would probably be L1 because the body is not as thick as we would see perhaps in L4 or L5. There's still a transverse process pointing out laterally. The spinous process has a distinct different shape. And what's noticeable, it looks more like the nose of a moose versus a giraffe. So you can distinctly tell the differences between a thoracic vertebra and a lumbar vertebra. When we look at the superior view of the atlas, remember there's only two vertebrae that have their own name. C1 is called the atlas, and C2 is called the axis. The atlas is the first cervical vertebra, which articulates with the occipital condyles. Remember, the occipital condyles can be seen from an inferior view of the skull, and they're on either side of the foramen magnum. So they support the head. One thing that is noticeable here is there is no body present, which would be seen in the other vertebra. There's still a superior articular facet, a transverse process, which has a transverse foramen. And again, remember the transverse foramen are only in the cervical vertebrae. For the second vertebra, that's called the axis. So the axis is the second cervical vertebra, and it has a bone marking, which is a process called the dens. The dens is very unique because it forms actually what's called a pivot articulation, which you'll be learning about in another chapter. That allows you to shake your head no. So the atlas can actually articulate with the axis. There's a superior articular facet, which in this case would articulate with the atlas. The transverse foramen is in the transverse process. There's also a pedicle, which, as you've seen before, is between basically where the lamina would be and the body. Remember, there's no body in the atlas, but there is a body in the axis in this case. And there's a spinous process, which looks like it kind of bifurcates like a forked tongue, and it's only really in the axis. So looking at this joint, it's called the atlantoaxial joint. And you haven't had joints yet, but you will coming up. And this is a unique pivot joint because that describes the exact motion. It allows for rotation of the head. So again, to shake your head no. This diagram is showing the axis of rotation. C1 is the atlas. The axis is C2, which we can see here. And again, the dens is going to rotate with the atlas, which is C1. Looking at the sacrum and the coccyx from an anterior view here, remember these are 5 fused vertebrae, and we can see all 5 fused vertebrae, S1, S2, S3, S4, and S5. Inferior to that is going to be the coccyx, which is C01 through C04. The thoracic cage is the next section of the axial skeleton, and it serves as the bony framework for the chest, which is where all 12 ribs articulate laterally on each side. So that gives us a grand total of 24 total ribs. The sternum is anterior. And remember that this is going to protect the vital thoracic cage, where we have such things as thoracic organs, the heart, lungs, trachea, esophagus, as well as within the mediastinum are those great vessels that you've learned about.